Hi, welcome to the March edition of the Bladder and Prostate Cancer Support Group. The topic of this talk today is on nutrition and sleep, and we're very fortunate to have Jennifer Staten, who is a licensed clinical social worker, and she has a presentation. And then at the conclusion of her presentation, we'll talk some more about these two very important issues. So Jennifer Staten is a licensed clinical social worker. She can be reached at her office at 903-577-6263, and her office is located at the Harts Bluff location. So Jennifer, take it away.
Okay, thank you. So, yeah, like Dr. Walsh said, we're going to talk about sleep and nutrition, and especially in regards to how sleep and nutrition can affect our mental health or exacerbate symptoms of mental health conditions we may already have underlying. So, can lack of sleep affect our mood? It's been shown that 1 week of insufficient sleep has the ability to alter our genes, and these genes control our responses to our stress and our overall health. So absolutely, a lack of sleep can alter our mood. Ongoing poor quality of sleep or lack of sleep increases our risk of depression and anxiety, impaired cognition, and poor concentration. A lot of times we'll see someone have symptoms that mimic ADHD or attention deficit disorder. And when you really get to the root of it, that's not at all what's going on. It's a lack of sleep. A lack of sleep will impair our memory and a person's ability to process the information they're trying to process on a day-to-day basis. For someone who already has maybe an impaired cognition or anxiety or depression, this can just continue to increase that for them. Sleep deprivation can cause someone to become more irritable, which then causes problems in their overall day-to-day living, occupational, if you have an increase in your irritability, or even in the home and in the social environment. So as far as depression goes, a lack of sleep can disrupt the neurotransmitters. These are the things that help regulate our mood. And with anxiety, a lack of sleep raises the brain's anticipatory reaction, and this increases the overall symptoms of the anxiety. So what does that mean? Basically, what it means is, like, if you already have depression and anxiety and then you have poor sleep quality, you're just asking for the symptoms of your depression and anxiety to be that much greater, no matter what you're doing to try to control them. If you're not getting the sleep your body needs, they'll just continue to be out of control. Someone who is very creative normally, and that's their outlet, their stress reliever, the way they cope with a mental illness, you see a decrease in the ability to be creative with lack of sleep, an increase in stress, and then just an overall increase in cognitive impairment. So what can we do for our sleep and our mood? The most important thing, and something that I spend a lot of time with some of my clients working on, is developing a good sleep hygiene or a good sleep routine. So that's simple things, really. I think we try to make them harder than what they are at times, but setting a schedule and sticking to it. And that means setting that schedule for 7 days a week and sticking to it 7 days a week. A lot of us, what we do is we set that schedule Monday through Friday, and we're really like just on top of things, and we're going to bed at a certain time and we're getting up at a certain time. And then the weekend comes and we completely go off the schedule. And it doesn't seem like a big deal, but it completely alters then our sleep routine, which then affects our mental health. Do not force yourself to go to sleep. So what I mean by that is, if you get in bed and you lay there for 20 or 30 minutes, you aren't able to fall asleep, maybe get up and go into the living room and read a book for a minute. You want to avoid or limit caffeine, alcohol, and nicotine. It's sometimes people believe that especially alcohol will cause good sleep, and what it does is it puts us into a deep sleep to begin with, but it's not good quality sleep, and then we wake up with poor sleep the rest of the night, which then overall affects our mood the next day. You want to create a relaxing bedtime routine for yourself. So you want to avoid difficult conversations close to bedtime. You want to avoid work close to bedtime. You want to avoid um, activities that maybe are stressing, um, which takes me to like exercise. Exercise is so important for helping us relax and have good sleep. But if we're doing vigorous, intense exercise right before bed, that has the ability to keep us up and not get good, restful sleep. You want to limit your screen time before bed or that blue light. Sleep in a comfortable environment, and then have a good, healthy diet. You don't, which goes back to the caffeine and alcohol, um, or fatty foods, processed foods. You want to limit that right at bedtime. Basically, starting with like just a few changes in your sleep routine when you're developing one. Don't try to do everything at once, but maybe try to set a schedule the first week and then start limiting some things the next week, or change the environment. You want to break that down and take it step by step and not just make the change all at once, because that could be very overwhelming for some also. In regards to our nutrition and our mental health, nutrition really does play a part in our mental health. So, mood disorders such as anxiety and depression can be affected by the foods we eat. And again, that goes back to processed foods, fatty foods, those foods that they look really good and enticing to eat, but then we just feel blah afterwards. They really do have an effect on our overall mental health also. So basically, a healthy diet causes less mood fluctuations just from the sugar in our food and other things. And when we have less mood fluctuations, overall, we have a happier outlook and an improved ability to concentrate. When we have that happier outlook and we are able to concentrate better, you will see lower symptoms or lower risk of anxiety, depression, and other mood disorders. Um, Overall, a healthier diet is associated with lowering the risk of so many things, and that includes anxiety and depression and our mood disorders.
Jennifer, thank you. That was very informative. And as a urologist, I certainly see a lot of patients that complain of nocturia, which is actually the symptom complaint of getting up to urinate at night, and which of course is not normal. And oftentimes we find out that it's abnormal, it's excess fluid intake or the wrong fluids at night. How would you counsel those patients that are drinking fluids before bedtime or at night when they wake up to go to the bathroom?
I think, like, when you're setting that healthy sleep routine, really being aware that this is an issue for yourself, because it's probably not going to affect everybody the same way, and begin, start like maybe 30 minutes before instead of right before I go to sleep, and see if that makes a difference. And if it doesn't, then push that back to 45 minutes or an hour, and just find that time where I need to cut off or limit my fluids at night.
Yeah, that's great. I mean, so I'd say, generally it's very healthy for people to drink ample fluids, whether it's water
Yeah,
or, have a cup of
absolutely.
coffee in the morning. And limiting their fluid after dinner is typically a recommendation that I give
Yeah.
patients for that. And so we start generally with dietary and lifestyle modifications. And then if the symptoms still persist of getting up at night to urinate, then proceed to medical therapy or other surgical interventions.
Yeah.
The other thing I wanted to point out, this being, part of the bladder and prostate cancer support group, is there are a lot of great resources at the hospital, and Jennifer Staten is one of them, for people that have bladder or prostate cancer, or any cancer for that matter. Christina Graham is a dietitian that's also at the Harts Bluff campus, and her phone number is 903-577-2273. She's also an excellent person to consult with if you have a diagnosis of cancer. Oftentimes people, if they're diagnosed with bladder cancer or prostate cancer, one of the first things they ask is, well, hey, doc, what can I do? Are there supplements that I can take? It's important to understand that supplements are not regulated by the FDA, and they can make claims as to their efficacy, but those claims aren't substantiated. In fact, there's been a number of clinical trials that go through phase 3 that, by and large, for bladder and prostate cancer, show negative results in phase 3 trials, and actually it can be harmful. For instance, with selenium and vitamin E, there's ample amounts of these nutrients present in a normal, healthy diet. And so a big part of what pushes patients into looking at these as something that they can take to help fight their cancer is really one of developing a sense of control over cancer, which is not, they can't control otherwise.
Right.
And so, normally as a clinician, we want to harness that interest into their own personal well-being and pushing that through, but channel it into things which are very well known to have a great impact on cancer and overall survival, cancer treatment over survival, and that's nutrition in general, but also exercise and the avoidance of harmful activities. For instance, smoking. There's a well-known correlation between smoking and bladder cancer, and the ability to stop smoking and to get the counseling you need to stop smoking will help prevent that cancer, that bladder cancer recurrence, and even progression. And sometimes it's difficult to do on your own, so we have support for you at the hospital to help you kick the smoking habit if you need it, or you can talk to your primary care physician. So the answer isn't necessarily into focusing on a certain supplement to combat cancer, but it's a bigger picture that is appropriate diet and exercise. And the appropriate diet is really going to depend on what your medical problems are in general. For instance, if you're diabetic, if you have heart disease, and these are specific diets that we can discuss, or you can discuss with your primary care physician or with a nutritionist. Again, it's Christina Graham, and she is an excellent resource for patients here. In addition, we can't underestimate the impact that a healthy lifestyle, including exercise, has on surviving the cancer and extending your longevity. And to that end, there's a wellness center located at the hospital it's very convenient to use, and you do have to pay for a membership, but it's very reasonable. And then on top of that membership, if you're referred by a physician, you can have specific exercise counseling. And so talk to your physician about using the wellness center at the hospital. So the three important takeaway messages that I'd like you to take home from this short presentation are, one, there are resources at the hospital that can help with you, either with Jennifer Staten, who's a licensed clinical social worker, or Christina Graham, who's a nutritionist. There's a wellness center at the hospital. You do have control over your body and what you put into it, and what you do with your body. And we want to make sure that if you have cancer, that you're fighting it in the best possible way. So do we have any questions from the audience? You said there's one? Yeah, so the data on selenium, it's been researched through phase 3 placebo-controlled trial that the results are questionable whether it actually reduces bladder cancer. And there's some data that suggests that the nutrient in selenium are adequately provided in healthy foods. When it comes to specific supplements, there actually is quite a bit of data that's available, and a lot of the data shows a negative benefit for taking additional supplements over what you would normally eat in your diet. And There's even some data that certain supplements can cause an adverse health effect. So when asking or when talking to your physician about the effects of supplements on your condition, there's not really a general statement. You'd need to ask the clinician about which supplement you're interested in taking, and then they can look into determining what the research shows about that specific supplement. So, hey, Jennifer, do you have any other comments before we end the meeting? Well, hey, thank you very much for attending, and we really appreciate your input, and look forward to the next meeting, which is in 2 months. All right, so stay posted. Thank you very much for joining us.